So welcome back to class today. We are going to cover chapter 13 today, which, good for you, is a very short chapter and it's a pretty easy chapter. So maybe extra time this afternoon to go enjoy non-econ stuff. The title of the chapter is Technology and the Price of Healthcare. And we're just going to start with a simple observation. The observation is that specifically in the United States, expenditures on medical goods and services are increasing much faster than expenditures on other goods. So if you recall back to a picture that I showed you early on in the class that plotted the share of GDP that each country spends on healthcare over time, in the United States there was this outlier on the graph because in the United States we spend a huge percentage of our GDP on healthcare, and that pie slice that goes towards healthcare is getting fatter and fatter over time in the United States. So what that means is that the amount of money we're spending on healthcare is just outpacing the growth in that, is outpacing the growth in our extra spending on other things. So this begs an important question that's particularly relevant for the health economists, and that is, why are we spending so much more on medical goods relative to other things in the United States? Okay, so to kind of disentangle this, let's just look at a very specific equation. This is the equation for healthcare expenditures. Expenditures are just a product of the price of healthcare and the quantity of healthcare. So what this means is that either prices are going up, and that's attributing to the increased expenditures, or we're just consuming more medical goods and services in the United States, and so the Q is increasing, and this is leading to more medical expenditures. Okay, what's important to note is that both of these stories are plausible. So let's just think about the story of prices going up. So one thing that could be happening is that the costs for healthcare are increasing. So, for example, if doctors' salaries are increasing, or the actual inputs that are needed to create MRI machines and x-rays, if those are becoming more expensive, then it's plausible that the price of healthcare is just going to increase as a result. It's also plausible that prices are going up in healthcare because of less competitive markets. So as hospitals merge, they gain market power, and so they can kind of hike up their prices more, and so it's very plausible that prices might be going up because of less competition. Another plausible story for why prices might be going up is that we do a lot of R&D in the United States, and so there are whole teams of people in biomedical engineering who are just tasked with coming up with new medical technologies, and R&D is super expensive. And so to finance that, the money has to come from somewhere. And so it could be that healthcare is becoming more expensive or more pricey because of the expense of new medical technology. Okay, it's also very plausible that we're just consuming more healthcare in the United States than we ever have been. And so our Q is increasing, and that's leading to larger expenditures. Okay, this story is even less of a stretch to kind of tell. So one thing that's happening in the United States, which is great, is that life expectancies are increasing. So think about how this impacts our utilization of healthcare. If people are living longer, then each person requires healthcare for more years. And so if you look at the fixed quantity of healthcare that's consumed per person, well, over time, if each person's living longer, then each person is using more healthcare, their own quantity is higher. And so this could be leading to the extra expenditures because we just have this longevity issue that's impacting our spending in healthcare. Another story for why Q might be increasing is because, I guess up until this year when the economy was doing really well, the population was getting richer. And so we think that healthcare is a normal good. A normal good is one where if a person's income increases, they demand more of the good. So if the economy is booming and people just have extra money to spend, well, why not go get that extra checkup every year because you can afford it? And so quantity might be increasing simply because of like a booming economy. Another story you could tell for why Q might be going up is that insurance coverage which has expanded in the United States in the last decade, might prompt people to get more health care. So you think about all the states that expanded Medicaid, suddenly a lot of people got an insurance card. If you have insurance coverage, well, you're more likely to go to the doctor now because now you're not having to pay for out of pocket. So another phenomenon that's, again, very plausible is that the expansion of insurance in the United States could be contributing to extra utilization of healthcare. And so this causes the queue to increase. As a result, the overall expenditures rise. There's some other stories that we can tell, but I'll kind of stop with those. But what I'm trying to get across is that, we have these expenditures on healthcare in the United States that are just like not proportionate at all. And we're just kind of exponentially spending more on healthcare relative to other things. And so in very simple terms, either this must be because healthcare is getting really expensive, the price is going up, and or we're just consuming like disproportionate amounts of it across time, or the increase in our consumption is just like disproportionately increasing. Okay, what's important to note is that if expenditures are increasing because of increases in the price, this is actually bad news, because what this means is that if you want to get a fixed amount of healthcare or a particular healthcare good, you're just going to have to spend more money for it. And so there's really no scenario in which this is like good news for a consumer. On the other hand, if these increased expenditures in the United States are because of increased consumption of healthcare or increased queue, this might not be bad, because the story here would be, well, people are getting more healthcare, and to the extent that healthcare is useful for improving physical health, then maybe we shouldn't be concerned about these like out of whack levels of spending in healthcare, because if it's useful, then so be it. We're spending a lot, but maybe extra utilization is worth it. But again, that depends on the expenditures going up because of a utilization story and not a price story. So, okay, so this is the kind of the complication for an economist. What we would like to do is we'd like to disentangle why expenditures are increasing. Is it because prices are going up, or is it because quantities are going up? So to determine whether increases in prices or increases in quantity is driving the increased expenditure in healthcare, we can measure something called medical inflation. Okay, this is going to allow us to basically determine yes or no whether or not prices are increasing. So if the answer to kind of this exercise, or if what this exercise reveals is that prices are increasing, well, then we at least know increased prices are contributing to this expenditure growth. If we calculate medical inflation and we find that prices aren't rising, then the increased expenditures must be coming from higher levels of Q, or higher levels of healthcare consumption. Okay, so to mechanically measure medical inflation, we use something called a medical care consumer price index. Okay, the medical care CPI, or consumer price index, tracks the changes in the prices of medical goods and services over time. So there's a very particular tactic that it takes to do this. To calculate the medical care CPI, what we do is we create a bundle of goods and services that approximates a typical consumer's yearly medical care purchases. We then compare the amount of money it takes to buy the bundle from one year to the next. So in very simple terms, the idea here is we think about, for a typical person, what is all the healthcare that you need in a year? Maybe a typical person needs one doctor visit, they need one box of Band-Aids, they need one bottle of Tylenol, for example. Okay, what we then do is we take all of those things and we put them in a bucket or a bundle. And then we say, okay, we've got this stuff in our bundle. We've got a doctor visit, we've got a bottle of Tylenol, we've got a box of Band-Aids. Today, how much does it cost me to buy this bag of stuff? Okay, then we take that bag and we just lug it with us to the next year. And then in the next year, we ask ourselves, how much money does it take now to buy the same bundle of stuff? And then we lug that bucket or that basket to the next year. And then in that next year, we ask ourselves, how much money does it cost to buy the same stuff? And the idea is if the same bundle of stuff becomes more expensive over time, then clearly there's medical inflation. Okay, so as an example, Suppose there are two goods in the bundle, and we'll just call these goods A and B. So again, this is very simplistic, but it helps get the point across. If there are two items in the bundle, then the equation for the index is basically going to be a ratio. Okay, on the screen I have the equation. The superscripts denote which good we're looking at. The subscripts, the ones and the zeros, indicate which time period we're considering. So a subscript 0 indicates like the initial time period. Subscript 1 means the time period following the initial time period. Okay, so let's start in the denominator. The denominator is equal to the price of good A initially times the quantity of good A initially. In other words, all the money we spend on good A, plus the price of good B initially times the quantity of good B initially, which is another way of expressing what we spend on good B initially. And then you add up those two products, and basically the denominator is just the sum total of how much it costs to buy all the units of A and B that a typical consumer utilizes throughout the year. Okay, note that only one thing changes when we look up to the numerator. In the numerator, everything stays exactly the same except we update the prices. And specifically, instead of using the original prices, we use the prices in the next time period 1. So what the overall index is the ratio of the prices of yesterday's goods at today's prices to, in the denominator, the price of yesterday's goods at yesterday's prices. Okay, think about how we would expect, or what kind of number we would expect to spit out of this ratio. If the whole ratio is bigger than 1, then that means the numerator is larger than the denominator. If the numerator is larger than the denominator, then that means the bundle of stuff costs more in time period 1 than it does in time period 0. Therefore, there's inflation. Conversely, if the whole ratio is less than 1, that means the numerator is smaller than the denominator. That's another way of saying that in time period 1, stuff is cheaper than it was initially. Okay, here's something that's important to note. As the index increases in value, consumers are worse off because it is taking more money to get the same stuff. So in other words, we don't like it when there's inflation because that just means prices are going up and people don't necessarily benefit from just stuff being more expensive. And so if the index 1 is a large number, that means there's inflation. But if the magnitude of the number is getting bigger when we look at time periods that are kind of further into the future, that means that the inflation is kind of growing. We're getting, it's becoming more extreme. Okay, the last thing to kind of note here is this index is really useful because it provides a very simple tool for us to just gauge immediately whether or not inflation is a part of this story of expenditures going up in the United States. However, there are limitations of the index. So what I'm going to do is I'm just going to briefly describe to you some of the limitations. Okay, the first limitation is the index only works if the bundle of typical medical care purchases does not vary historically. So in other words, when we're using the index, we have good A and good B, and good A and good B, and we don't ever kind of allow a new good C to kind of slip into the bundle. And this isn't super realistic because over time we come up with new medical technologies. And so today, what might be in a typical consumer's medical care purchase bundle might be some kind of procedure that your primary care doctor does to you that was not in existence 100 years ago. So if we started out trying to kind of calculate this index 100 years ago, well, then clearly that item wouldn't be included in the bundle because it wasn't in existence. So because the bundle of stuff is required to be rigid from year to year for comparison purposes, this doesn't allow for the flexibility for us to add extra things to the bundle as we kind of come up with new technologies. Okay, the other kind of limitation is not only do we come up with new things, but for a particular medical problem, sometimes we start treating that problem using different things. Um, so, for example, a long time ago, if someone had a fever, then what would they do? They'd stick a leech on them, and that would have been like the standard of care. Well, now we don't use leeches anymore, we just give somebody a Tylenol. So because again the bundle is rigid in terms of what it contains, it also doesn't allow for swap outs. So we can't kind of say, well, previously a leech was in the bundle, now we're going to swap out a leech because we know it's not effective, we're going to put in like one Tylenol, because again the bundle has to stay rigid. Okay, but that said, the index is still a very useful tool for us to use, and presuming we're trying to measure inflation in a relatively short time period, so for example from like 2015 to 2020, well, in those short time horizons, there's not huge variation in treatment regimes, and so this kind of limitation of keeping the bundle fixed isn't an especially big problem. But the longer time horizons we're looking at, the more it kind of becomes a problem. Okay, so that is it for chapter 13. If you have any questions about this, let me know, and then after the 10-minute break, we'll come back for the exercise. For today's exercise, I'm just going to have you calculate the value of the medical care consumer price index under a given scenario. So assume the bundle of goods and services that approximates a typical consumer's yearly medical purchases consists of 2 doctor visits and 1 unit of prescription medication. Suppose that in 2019, the price of each doctor visit was $500 and the price of each unit of prescription medication was $1,000. And then the next year, in 2020, the price of each doctor visit rises to $600 and the price of each unit of prescription medication falls to $900. Okay, the first thing you need to do is to calculate the value of the medical care consumer price index. So for this question, use the structure of the equation that I gave you and calculate the value of the index. So your answer should be a number. And then the second part is I would like you to explain in words what your answer to the first question tells us about the price of medical goods and services. So this is going to be kind of a descriptive answer to just kind of unpack what the meaning of the number is. Make sure both of these questions are clear in your mind. Hopefully they're not confusing. If you're having trouble with this, that should be a red flag to kind of seek help. And if you do need help, definitely let me know. So turn in these 2 questions and then enjoy the rest of your day.